Katata curve, ka trendsetter SUV ka bawandar kalapoy ha Shillong. One ban test drive ka coupe SUV paningkong ekari ani pila ban phone tikin number bala ay harum. Kakong Ampareen lingdo Menteri Ketenaga Kokot ke jong Jylla hak sngi balang kalapan tiba ke Indian Council of Medical Research ICMR kalapan tiba ke Jylla Meghalaya kadon hadu shispa nyo pun ringut ki bapang Bampong cancer nakashila kinong shong hak Jylla. Menteri habe kren bikinong thok Khubor kalapan tiba ke East Khasi Hills kalathayu ke rekod bakidon arspa arpun nyongut ki bapang Bampong nakashilak ka jingdon jukinong shong bat kelandang tam ya ke national average haka jing ajing sumar ki nong pang Bampong ka balong shispangot nakashilangot ki nong shong. Hakapay day bat kani ka Jingpang ka menteri kalay thuba nakalyang ka sorkar kalashim kya ban pentik na baka Jylla kan laban ya kun prasha ya kani ka Jingpang ringkat bat ka jing ajing sumar ya ki wei ki Jingpang ru. Ka menteri kalapan tiba hapo Shillong Civil Hospital ki don baro prahajar laispa prapu arngut ki nongpang Bampong ki bawan pa sumar tang haus nam ajar pusau. Ki don siajar henriuspa sau pundai ki badai badang shuwan thamai bat ki don sau spa san pun ringut ki nongpang ki badon kam banle ya ka radiotherapy. Shusho kalo ongru baga sorkar menta kan kintiu kardano ya ka cancer wing jong Shillong Civil Hospital na ka san po jingtia saka khandai po jingtia bat ki dang pan ban kintiu no shaka arspa jingthia.
Commemoration of World Cancer Day 2025. I would like to send a very clear message to all citizens who are in some way or the other affected by the most dreaded disease of the modern generation, one of them at least, and that is cancer. This year, it has been decided that we would focus on individual patients. Therefore, the theme of this year's Cancer Commemoration Day is United by Unique. Not all cancer patients are at the same level of community and society. Each have their own challenges. The disease and its manifestation also has its own unique challenges. Many of these challenges are now ably addressed in the cancer hospital at Civil, and we are very grateful that the Negrams is also now upgrading its facility, where we will likely have important tests that can be again taken up by Negrams. Say, for example, the PET scan and all of these important indicators for treatment of cancer are very much required in the state, and the government is well seized. There are different sets of problems for the different sets of issues that arise because of our inability to attend to treating cancer for every citizen. So we are now also very confident that as a department, we are able to at least test at the district. Earlier, this was a far dream, but today, even our centers in districts are well equipped for the early detection of cancer. Once upon a time, patients suffering from cancer would only know that they were cancer patients at very late stages. But today, cancer patients quickly get tested, quickly get treated, and continue good living, a good life, and live so many years beyond the expectations and beyond the predictions of the medical fraternity. So yes, today this is the situation of cancer in the state of Meghalaya. We are also very happy that Honorable Chief Minister is seized of this problem, and hence today we have already announced a project like Meg Can Care. This Meg Can Care project is on a mission mode and is supported directly by the government of Meghalaya. And we are also very, very happy to share with the people of the state that the MHIS scheme itself is very inclusive. And across the various slabs of the society, everyone has access to this care, and the state stands committed in its policy decision that we have to curb out of pocket expenses, and we are doing the very best to ensure that we are there when people are in need for out of pocket expenses to combat the dreaded disease called cancer. State of Meghalaya is unfortunately one of the highest detectors of mouth and esophagus cancer in the state, and we are taking administrative decisions to ensure that we are ready to face and combat this disease in its current situation. In the recent data that was collected in the state of Meghalaya, we see this rise, and this rise is what is very concerning to the state. Say the ICMR data discloses that we have as many as 176 cancer cases per 1 lakh population. That is big. Whereas in East Khasi Hills, it is also factual that we have registered and recorded 227 cases per 1 lakh population. The national average for cancer treatment, detection, and others is about 100 per 1 lakh population. So we're way ahead of the national average. So that we combat this disease alongside attending to other diseases also. The non-communicable diseases, which is today becoming a threat, hypertension, heart, kidney disorders, liver disorders, all of these are better positioned in as far as our treatment is concerned. So yes, on this special day, I want to send out this message to people living with cancer. You are not alone. Government is with you. We will try our sincerest best to address individually, because as the theme says, it is a complex matter and individual concerns are unique in their own nature. So like I said, very often citizens themselves lack the trust in their own systems. Today, civil hospital on an average in 2024 has a total of 8,382 outdoor cancer patients. Of these, only in the year 2024, 1,649 new entries. And in radiotherapy alone, out of this entire total, 456 patients require radiotherapy. We have now upgraded the 50 bed to 90 bed, and we are preparing proposals to increase it to 200 beds. We are aware that we have technical issues of availability of specialized manpower. We are dealing with this, and we are also sending doctors to prepare themselves and get the correct training so that they can return to the state and address the shortfall that we have in the system. We are also concerned and talking to Negrams. We have committees already set up. We are sharing information with Negrams. We are constantly updating ourselves with sending patients from low income groups to nearer and closer facilities like Negrams. We have state of the art operating facilities in Negrams. They can actually do specialized cancer surgeries with departmental specific requirements. One message that has to go out to the public: don't need to go too far. You can take the treatment in your own state. At best, we are in close touch with institutions like the GMC, the Barwa Cancer Institute, and the Northeast Cancer Institute, which are still within reach of the common man from a low income group. Consult your cancer situation with your physicians and try your best to have faith in your own systems instead of reaching out to very far flung places where your cost for cancer treatment increases 3 times, 4 times. So, if I have to get into all the technical details, then I may go wrong because I'm not a physician, nor am I an MBBS specialist to talk about it. But yes, we are trying to create awareness, which is the basic of all information. We are trying to create, we have banned consumption of tobacco. We have joined hands with Government of India and World Health Organization in publicizing consumables in the community which have cancerous effects. We are increasing our cost expenditure on advertisements. We are involving church forums, community forums, health organizations across the board, which is why today you will see that when somebody is told that they are suffering from cancer, that immediate deep fear is no longer there, because they know that the state and the nation is capable of addressing cancer treatment. All of the other Asian countries also come to India for cancer treatment. We've seen the numbers across the board through multiple institutions like AIMS, plus private institutions like Gangaram, semi-private institutions like Medanta, like Fortis, Tata, Birla, and we're very grateful to all of these leaders in the business world who also dedicate institutions with excellence to these kinds of treatments, knowing very well that they are cost intensive. All types of cancer are covered. This is again a very technical question because I have to look at the numbers. We have a live dashboard. You can also go to the live dashboard on the MHIS, Meghalaya MHIS website. Please go. Look at the kind of investment we are making for all of these treatments of all of the diseases. But because cancer is alarming, we would like, and hence we have already focused our attention and made these packages available for citizens to avail up to the block level. And for is the opposite component of treatment. If you want to treat, you have to do research. If you want to do research, you have to do courses. You have to take the correct course of action. So we have all these institutes that are already on the job. We already know that there are two, three institutes that are focusing their attention on cancer treatment. The ICMR is one big institution, and then we have the population-based cancer registry. This is also a big attempt, not just for collection of data, but also to research academically and intelligently so that we may have treatments specific for these kinds of cancers. Government cannot on its own do all of that, but we are in touch with research institutions that are anyways focusing their only attention on all of this.